All right, so it is December 11th, 2023, and the Board of Health meeting is called to order. I guess we don't have a quorum.
We don't have a quorum, so we can't do items 1 or 2 or 3, or actually 2 and 3.
Right.
But
we can have an informational meeting, and can I have a motion? So Santina, you're on the line.
Yes, I am.
Oh, so do I need to make? I'll make.
Yeah, we're going out of order.
All right, make a motion to allow Santina to go.
Actually, we don't have a quorum.
Oh, we don't have a quorum, so.
You do what you please.
Well, yeah, so then it's your discretion. Yeah, we actually can't vote on anything.
No, we can't vote on anything. That's too bad. That's unfortunate. So Santina, we're having an informational meeting, so I know you're busy, so if you can, you can start our meeting, that would be great.
Okay, awesome. So just a few things. First, like with COVID, we are still, keeping an eye on daily cases and watching the trends. Right now, we're monitoring the cases from the holidays, and it seems like it's steadily increasing. So, with that, we're just pushing out information on our social media about ways to prevent the spread of COVID, like staying home if you're sick, testing if you're not feeling well, covering your cough and sneeze, things like that. We did a Know Your Numbers campaign. We had, it was really targeted towards Town of Fairfield employees, and we had about 12 people come to get Know Your Numbers done, so that was really good. A few weeks ago, the public health nurse and I went and did a Flu and You presentation with the daycare at Fairfield U. They are contracted through Stepping Stones Museum, and they asked us to come. We read a book to the kids about the flu, and then we talked about the importance of washing our hands. We did the glow germ presentation, and the importance of covering our cough when we're sick. We did another QPR training, and we were able to train 2 additional people with that. Back in October, to help celebrate Health Education Week, other health educators and I from other local health departments hosted a networking event, and I was the moderator with that, and we had about 40 students from the different universities, both undergrad and grad level public health students, and it was really, really great. They asked us questions about how we got involved in public health, and asked us questions about, working at a health department. So it was a really great event. And then I think San's kind of mentioned it, but the reason why I'm not there right now is we've been going through the process to get the approvals for the immunization grant and the workforce development grant. So right now I'm sitting in the lobby outside of the RTM meeting, waiting for that to start so that we can present there. And if it gets approved today, we have to come back on the 18th. And then hopefully we can get the first selectman's signature, and we'll be able to secure those funds. And I think that's it for me.
Great.
Okay.
Thank you very much, Santina.
And are people familiar with what the glow germ is? Glow germ. So, I'll take it for you, Santina, in the sense of that.
Okay.
So it's a hand washing demonstration where we put this liquid on their hands that glows under black light, and so we then have them, we usually mock I just sneezed into my hand and I shook your hand. You put it on our hands, you shake their hand, or you do something where you touch them or put it on their hands, and then they wash their hand. You show it to them, then they go wash their hands, and usually they don't do a good enough job to get it all off, so they'll still see it glowing, and it simulates this is like germs, So it's a fun demo for the kids and stuff. We've done it for years in the schools and other locations with small kids. So
do that with small kids, big kids, adults.
I know.
Yeah. Hand washing in the hospital, if they see you washing your hands funny, they'll let you know.
Yeah. Oh yeah.
That's funny.
Yeah.
So since you had
Sure. I'll go into sort of my report. As Santina mentioned, we're working through the grants. We've got two out of the 4 approvals we need, so we'll hopefully plug that away. I did meet again with the HIA Health Improvement Alliance coordinating team. to continue our conversations and working with the contractor that we're using to do the community health assessment and community health improvement plan. And so we're happy, some of the concerns that we raised about the issue is regarding the quality of the data. And so this year, the contractor has agreed to include a local data collection provision in addition to, so he does a very scientific data collection. I think we talked about this last time. Random digit dial phone survey, it's great, but when you get down to the local level, the data is too small to be good. So he said that he is working on, while it won't be to the same level of quality as the other data, a component where we can, provide residents with a link to complete the survey and do it on their own, so we can collect a lot more data. It's essentially qualitative data, not really, qualitative data, not quantitative in the same way the other data is, but it provides us with another, to be able to say we collected thousands of surveys instead of 250 has value in the sense that it represents more of the population. And as long as that data is consistent with the other data collected, it has value. So we were pleased to hear that. We're continuing to work with the contractor, and we'll be launching, the initial data collection in early as I want to say February of this year. I think they're going for early February, and we'll collect for 3 or 4 months, starting that process. So we're happy about that.
How do they collect it now? I'm just curious. I mean, everyone has cell phones. No one's tied to a landline with an address anymore.
Yeah.
How do they ascertain where people are living?
So they use a professional phone survey company to collect that portion. They do the analysis of the data. Data Haven does, but they use different companies. It was Sienna Survey Research or something like that they hired this time. But it's a professional survey company that has all the cell phone numbers.
So buying the lists and all that.
Yeah, they buy all the lists. They do all that stuff, and they, basically continue to survey until they get the right demographics, if you will. If it's 51% men and 49% female, they survey that, and if it's different ethnicities, they make sure percentage of ethnicities to capture that, and so they do this, great job collecting the data. So they'll end up surveying a lot more people to get the right balance on the data. So, but it's a great company. If you just look at their website, Data Haven, they've got lots of great resources there. So we did meet together as a region to review and make comment on the Region 1 Volunteer Reception Center plan. So one of the things that are in big emergencies that causes problems is spontaneous volunteers, people who just show up saying, I want to help. And so one of the roles of public health is looking into how can we better control that and better direct volunteers so they don't create additional problems and things like donation management and all this stuff that comes in that we try to avoid. And we've been successful locally in sort of avoiding that. After 9/11, they had warehouses full of bottles of water and tube socks. Somebody said tube socks, they need tube socks. And so they donated tube socks, truckloads showed up, and so things like that can happen after disasters. This is an effort to try to avoid that and to give people who want to help, give them a pathway to follow. And so we're working on that plan. On the 7th, just last week, we met with the town's emergency management team and the first selectman and the chief of staff, along with police, fire, public works, all the heads of the departments related to emergency management, and everybody got to kind of share their role and how the town typically operates during emergencies. So it was a briefing for the first select person and the chief of staff to get them familiar with, or more familiar, I should say, with how the town operates during emergencies and the structure and the incident command structure and how we operate. So it was a good meeting. We continue, as in the attachments you saw, continue to work on the annual reports, trying to finish the 22-23 report, and then we'll be all caught up and, ready to start on the, 23 DPH annual report, which they haven't, usually they send out a thing in September, but they haven't done it yet. I keep saying it'll come soon, so we'll start on that with the state, and that's another report we have to give to the state. We did, several department staff participated in a training on the managing difficult conversations with your constituents. Very good training organized through CCM, and I'm trying to remember the name of the consultant. Do you remember that, Andrea? Braver Angels was the name of the consultant, and they're sort of this interesting group that, you know, is really about bridging divisiveness that exists in society, and so, you know, in whatever realm, in political and religious and just public speaking, and they did this training on just managing these conversations with constituents. So I thought it was very good. We had several staff participate. We did this past month issued 14 orders to comply in the environmental section. A lot of dwellings with no certificates of rental occupancy, so we're sort of enforcing that. So it was a little bit of a busy month, and a couple other issues built in, you know, on top of those rental certificates. But so the inspectors are very busy with that. And then we did have some work related to the, there was a cinnamon applesauce pouch recall that was caused some 22 cases of lead poisoning. And so these were sold in Dollar Tree stores and on Amazon. So we did a fair amount of social media posting and, you know, putting the word out on that, and reviewing cases. So we did have one blood lead elevation during that time in a child. So the sanitarians reached out to that case to initiate an investigation. And in the same way, we had some notifications about, and you may get these at the hospital, but an alert about some human-to-human transmission of, so there's Mpox cases, and in Mpox there's two different clades of viruses, and one of those viruses is the same one that where we had the outbreak a couple years ago, and now they're seeing human-to-human transmission of the other clade going on in the Democratic Republic of Congo. So there's a concern about that, and just you know, to sort of getting the word out to local practitioners to be aware of that and consider testing for clade 1 if there was a history of travel to that area of the world. And then we were notified of some Rocky Mountain spotted fever, severe and fatal cases amongst travelers to Tecate, Mexico. And so we're getting the word out on that on social media as well. We continue to work on blight cases. We've had some success in recently resolving one of our longest standing blight cases that we've had that had over $100,000 in fines. And finally got that resolved. And so now we're working on the second oldest one, which has about, I want to say, $80,000 to $90,000 of fines. And so we're moving forward with that, hopefully. It's a very complicated one where we have the town attorney involved, and just trying to get making sure all the T's are crossed appropriately, and trying to move this along as quickly as possible. We continue to meet with the Department of Public Health, has a once-a-month meeting with infection preventionists and infectious disease staff. This month was talking about antibiotic resistance, and there's some new programs coming down from the CDC to the state, where the state has been able to hire some additional staff that focus on this issue. And so the state also came out with like a toolkit, which has rules for state health departments and local health departments, in addition to hospitals and long-term care facilities and other facilities. And so we'll be implementing some of those practices locally about, efforts to, to help stem antibiotic resistance. And I'm trying to think if there's anything else. I think think I covered everything. And then lastly, I will say that the health department is working to help organize for the seniors a holiday sing-along. And so we've got 16 members that have signed up for the No Talent Required choir. And so we'll be leading a sing-along on the 21st at the senior center. With the first selectman has signed up to join our choir, and the chief of staff and the fire chief. I put a little pressure on the police chief today. I may be busy.
That is great.
So that's my report for tonight.
Thank you very much.
And then we cannot take action on the other items on the thing, and we'll have to put the election off till next month, which is something that happens.
Right.
And then, by next month, we'll have, hopefully have a full board, with the newly appointed, member. And, now, I think you were reappointed already.
I don't even know, but
I think you may have been on, well, I'll check, but
I'll comment.
I know you're, so I guess maybe they'll do it at the next meeting if they didn't get to the Board of Health, because I was at the other
Right.
the meeting, reached the fourth meeting on the 4th, and so anyway, so we'll have a full board
Great.
at the next meeting. So
I know you've got to run, so.
well, I told Santina I'll be right over. I should be over by no later than 9:30, 10 o'clock.
I just want you to know I'm still on the phone, so I know what time the meeting ended.
What agenda item are they on, Santina?
I think they just started with police, so.
Oh, so we're still a long way
Okay.
away. Okay.
Does anyone have a chance to look at the calendar? Is there any dates there was only one date in October that would be the third Monday. Everything else is the second
I was gonna say,
Monday.
the same cadence.
Yeah, it's the second Monday, if that still works.
Fine.
Okay, that way.
You can't vote on it.
Right, but if
if
anything
you have any
needed to be
concerns about a
adjusted.
particular date,
Yeah.
just let us know.
Good,
Okay, great.
All right, well, stop the recording.
all right. Do we end the meeting? I
Well,
don't
there's
know.
no, we
Okay.
don't need a.
Yeah,
no,
Bye,
we don't
everyone.
need-